How's it going, guys? This is Chris Bryan, and in this video we're going to be talking about patellar tendinopathy within jumping populations. Also within this video we're going to be going over how to monitor and manage the training loads that we give in athletes within the environments that we create as coaches. And then finally, what can we do right before games or right before practices and training sessions to kind of help monitor or kind of modulate the pain that the athletes are going through, and also help them perform within the sports that we have them playing through. In this video, we're going to be giving over backgrounds of information as far as the science behind patellar tendinopathy, while adding training sessions that I have within the off season of some of my basketball athletes, just kind of help through with also the video. All right, so this leads us to our first topic. It's what do we know about patellar tendinopathy? What we do know is it's a common injury or also a localized pain that occurs within the patellar tendon and also within the patella bone. We can see this a lot with sports that have very high eccentric muscle contractions through movements such as jumping, landing, or even in cutting, that have a very high volume or maybe even high intensities that's too much for the athletes to withstand due to a lot of mechanical loading within the patella joint or within the patella tendon. An article by Gilda explains that we believe that patellar tendinopathy is an occurrence of combinations of inflammatory and also degenerative processes that goes with high intensities and high loadings of the patellar tendon through movements such as jumping and landing and also cutting. In studies that are within sports, it is said that up to 22% of elite athletes experience pain within the patella tendon. And of those 22%, almost up to 50% are within the elite populations of basketball and also volleyball. Detrimental effects of patellar tendon pain can lead to athletes loss of time within their sports, declines in sports performances or physical performance such as athleticism and also skill development, and also psychological consequences that can lead to depressions and also anxieties, self-consciousness, or at times withdrawing from sport. And with that, this leads us to our next topic. What are the high risk factors of patellar tendinopathy? As stated earlier, the occurrence of patellar tendinopathy is due to high repetitions due from mechanical overload of high intensities and also too high volumes. It's always important to note that the training environment, also the competition management, even the rehab processes are just a few things that goes into the equation of injury prevention of keeping the athletes healthy. A few things that I think us as coaches overlook, or even us as athletes overlook, is the stresses that occur outside of sports and outside of training, such as family, or let's say school, or even relationships with other people. Also go into the factor pool of injuries. Another thing that can go into it is just your sleeping habits and also your eating habits, or a few things that can go into high risk factors. Finally, even just previous injuries can also lead into more injuries if we don't take care of the right processes to keep the athletes healthy. For the purpose of this video, I'm just going to go over just specifically the training environment for the athlete. So to follow that, too much intensity and also too much volume are among the highest factors when it deals with patellar tendon pain. Right next to that is going to be too much rest or too much time away from sport or from activity. In addition, flexibility of the quads and hamstring muscle groups are a big high risk indicator. Biomechanical alignments and properties of motor tasks are another one. Following that is body composition, and not proper warm-ups or pre-activation before activities are all high risk factors that can potentially lead to athletes towards mechanical overload and the degenerative processes within lower body performances. So up next in part 2 of patellar tendinopathy for jumping populations, we're going to cover how to monitor and also manage the training loads that we see for athletes who are dealing with patellar tendon pain. So previously we talked about the risk factors from the training environment that are connected to patellar tendon pain. But how do we truly know if our athletes are experiencing this issue? As coaches who aren't warranted or necessarily able to write off or diagnose athletes with patellar tendinopathy or with patellar tendon pain due to medical accreditations that they may not have, it is in our best abilities or best understandings to understand pain symptoms and also how to modulate pain within the training environment. Localized pain that is located at the proximal insertion of the patella tendon all the way to the patella bone are signs that we must notice as the athletes bring it to our attention. Commonly, patellar tendon pain or even patellofemoral pain can occur throughout the day, within the morning, during physical activity, and also after physical activity. One great advice by Andrew Spock was to utilize objective-based methods to measure pain. In this article, he talks about using a numerical pain rated scale from 0 to 10 for athlete pain to monitor on the days of, right before activities, during activities, and also after activities. Through this, us as coaches, trainers, and practitioners can accommodate our training to fit the athlete's needs, adjust to manage their overload of the tendon, and also help athletes return to play. If you look closely at the model, Spratt gave us 4 guidelines to follow for tendon pain. Pain is allowed to reach a 5 on the pain scale. Pain after completion of activity is allowed to reach a 5 on the pain scale. Pain in the morning should not exceed a 5 on the pain scale. And lastly, pain and stiffness are not allowed to increase from week to week. An article by Masgrave displayed a great chart of management of tendon loading. We must understand that a tendon's response to training stimulus should dictate the management protocol. Through the individual graded running program template, the proper steps into improving acceptance through development of muscle and tendon capacities is one of the priority aspects of the program. Following that is the athlete's shock absorption capacity and leading into the retaining motor patterns that can be seen within the template. After patellar pain has been notified, isometric work may show to have added benefits of feeling desensitized within the pain within the joint. Also, strength development within joint-specific ranges can be seen. Isometric is a modality that is safe and effective for athlete training. These type of exercises implement isometric contractions without movements within targeted joints and also other multi-joints. Isometric can be used early on or during the competitive season and can be used for all ages with appropriate prescription. 2 types of isometrics are yielding isometrics, which can be seen in holding positions without or with resistant loading. And the second type of isometrics is overcoming isometrics. Through these is when we can maximally and also actively push through something such as a wall, a squat rack, or even an individual where movement is invisible. We can repeat isometrics several times throughout the day for up to 60 seconds, depending on what adaptations that we're looking for. And also we can go up to 4 to 5 sets per exercise, all the way up to 90% of the intensity. Next on the chart is strength development. Slow, heavy resistance training and also eccentric focus-based training show added benefits for reduction of the patellar tendon pain throughout the literature. With proper prescription and also practical applications, these exercises or training methods have shown to have up to 50% of improvement within 3 to 6 months. This means movements like squatting and also hinging with focuses on slow eccentrics and also slow concentrics can be a very useful tool when creating training programs. Next, after that is functional strength. Functional strength follows the strength phase, as now that our goal is to improve motor patterns and also build athletes to move dynamically with load. In regards to patellar tendon loading, an article by Garcia explains that horizontal loading through decelerated movements such as single leg and double leg tasks from landing and cutting. Through the article, and the decelerations from landing and planting showed 4 decelerations of the center of mass that may lead to added patellar tendon forces. It's largely important for us as coaches, trainers, and practitioners to teach and help athletes learn the proper motor task executional strategies to potentially limit them from falling into the high-risk categories. Next are speed and then plyometrics. Speed and plyometric are stages after the athlete has developed a solid foundation of muscle and also tendon strength capacities to help them protect themselves from increased pain within the patellar tendon. Through these, volume and intensity management has to continue to be adjusted as of now that an athlete is training on these aspects both in sport context and also in the training context. Plyometrics can be introduced early within the training and also increase appropriately as the athlete progresses through the reduction of their pain. 48 hours is a time frame in between plyometric training that is recommended for the athletes and also the training programs. There are 2 types of plyometrics, which are extensive plyos, where intensities are roughly low, but the duration and also the volume are moderate to high. And for the second one is intensive plyos, where intensities are very high or like game-like speeds with volumes that are roughly really low. As athletes begin to put all those things together through the progressions of the pyramid or also the progressions through the template, return to play is the last progression in which athletes can fully play within their sport. Once movement patterns and the connected changes improve, then plyometrics and sport-specific activities can be integrated through the work that an athlete's placed in. To wrap up all the training methods that we just went through, it's always important to integrate the pain-rated scale that we previously talked about with day-by-day, activity-by-activity, and also exercise-by-exercise with the athletes. As we see pain increase through the rated scale, we have to be able to accommodate the athletes by regressing the exercise or regressing the intensities and volumes that we place within the athlete's training program. For example, midway through a training, an athlete might feel like they're getting towards that 5 or maybe almost pushing past that 5. We might want to regress some of the exercises, or we might want to regress some of the reps, the volume, intensities, or maybe we might want to shut the athlete down just right there, just so they don't continue to increase the pain rate. In another example, an athlete may say that they reached a 5 or maybe exceeded the 5 in the morning after a training. Through that, we can understand that the training that we had previously from that morning could have been too intense or have too high of a volume for the athlete to withhold. So as a coach, a trainer, or even a practitioner, we can rearrange how we had the training program for the athlete as far as adjustments based on what the athlete says on the day after. Finally, in part 3 for patellar tendinopathy for jumping populations, we'll be going over a few things or a few approaches that we can take to prepare the athletes right before activities and also right before competitions. And how to prepare athletes for pre-game and also pre-activity. Creating a small version of Maslo's diagram is a great way to get athletes from going from cold tendons or also pain within the knees into having some warm and also activated muscles and tendons. Starting the athlete with isometrics through a combination of yielding and also overcoming exercises can allow for reductions in inhibitory drives, which can lead to improvements in quadricep maximal voluntary muscle contractions within the movements that the athletes are going to be going through. As stated previously, isometrics deemed very safe for before a game or before activity. Moderate to high intensities are a good recommendation right before the game, and also depending on the athlete's condition and also their role for the team, volumes that are low all the way up to high or medium to moderate are also good recommendations for the athlete. In a practical settings, it's sometimes hard to get access to a weight room or also weights right before the game for the athletes, especially when we're on the road or also right before away games. So as coaches and trainers and practitioners, we should have the ability to create similar environments to where the athlete can get the same needs that they can get from in a weight room setting, but also on the court setting. After isometrics, progressing the athlete to more functional and dynamic movements can begin the transition to the muscles and tendons to be performing more sport-like movements. Following that is implementing extensive plyometrics, intensive plyometrics, speed and reactive-based exercises. All those can have great benefits into getting the athletes more stimulated for game-like reads. Finally, getting the athlete to perform sport-like tasks such as in the shoot-arounds or in the layup lines is the last step to getting athletes prepared for the competition or even for their activities. All right, thank you guys for watching this video. Follow more for training tips.